Morning. So it's at 10 o'clock. And I think we seem to have a lot of people here online as well. I think I'm present. So, Ali, would you like to begin?
Yep. Can I just remind everybody that the meeting is being recorded and will be placed on websites for public viewing. And I'll now take a roll call for the minute. Councillor Lynn.
Present.
Bob Benson.
Present.
Councillor Toland.
Yeah, here, hiya.
Councillor McHugh.
Present.
David Cheap.
Present.
Colleen Carlton.
Present. Morning.
I've had apologies from Glenn Lloyd. Dave Berry.
Present.
Christine Jones. Present. David Wilson.
Present.
Jane Smith.
Present.
I've had apologies from Sanjay Pillai and Raymond Marshall. Jim McFarlane.
Ben Ali.
Christina Cooper. Nicola Stevens. Martin Slow.
Present.
David Shaw.
Present.
And that concludes the roll call. Will I just carry on, Chair?
Yes, please, yeah.
Item 1 is apologies, which have already been noted. Item 2 is declaration of interest. Are there any declarations? Not seeing any declarations. So that takes us on to item 3A, which is the minutes of the previous meetings from the 18th of February and the 31st of March, which are submitted for approval.
Yes, so we've been quite busy with 2 sets of meetings recently. So we'll start with the minutes of the meeting held on 18th February. Are there any matters arising from this? I don't see any hands in the room or online. Are we happy to agree these minutes? Thank you. And the minutes of the meeting, our budget meeting, which was held on the 31st of March. Any matters arising from this? Are we happy to agree these are an accurate record of the meeting? I'll take no comment as consent. Thank you. These are agreed.
Okay, that takes us then on item 3B, which is the action tracker, which is submitted for noting.
Yeah. Any comments on this? Which is, I was going to say one sheet, but it's actually 2 because I've printed on both sides. Any comments on the action tracker? I don't see any hands. Yes, I do. David.
Yeah, one again, it's not actually particularly any one. I just think it's quite worthwhile that gender slightly smaller that we actually could maybe just go through these one by one and just see what the activity is, because if things are in progress, there's a wee note, there's anything we need to be made aware of, because I mean the green ones could obviously come out now being complete, but rather than just say any comment, is there anything? I think we should probably address each action point. I would have thought maybe just for any comment from the floor. No.
Can do. Yeah, I think we can go through them. I think there's.
Well, we'll also do the green ones now. Yes, we just want to address the ones that are ongoing then, or in progress.
Yeah.
I think it's fair. We're probably in a position now with the action tracker where there are less and less outstanding actions. So I think it's probably appropriate we can kind of go through those ones kind of line by line. Although noticing that most of them have got my name against them, so I might change my mind on that. So the first item was around the kind of absence position, and so just see if
Have you got the
I'll be able to hear. Okay.
absence?
It's not great. It's not great. Sounds not great.
You're very disjointed in the room, I think.
I think it's when more than one person speaks, it kind of mashes in.
Does that? Then do that voice isolation being disabled.
Martin, so ex-telling and sort of IT experts from. Just hold on 1 second, we'll get that sorted. Or Martin, I should say.
So what does voice isolation do then?
He tries to focus the microphone to pick up the speaker. So, Dave, can you speak for a moment?
Okay, thanks, Martin.
Does that sound?
Is that an improvement? You can't use it.
Yeah, a little bit, yeah.
I actually think it's worse.
I thought it sounded a bit clearer after doing that, and when just one person's speaking, but maybe my computer.
I think Ken was a bit clearer, but Martin was very distorted, and I do wonder
Yeah.
if it's about room position.
Yeah.
I'm assuming the setup's the same as it was for the budget meeting when we didn't have any issues. Exactly the same setup. Yeah.
Yeah.
Voice isolation is still disabled, though, no?
Is that not because we're connected to the bar?
Yeah.
Oh, right, okay.
I think Ken's a bit clearer than he was.
Okay, that's unusual.
We'll just need to make sure we're talking as clearly as we can then.
Okay. An echo in the room, does that mean someone's got their mic there?
Dorothy shouting at us.
Anyway, yeah, do you want to carry on?
Yeah, sure. So the first item was around the absence position and whether we should have a kind of part of the development session around that. So and we can talk about schedule with action 9 below, which was around the sort of workforce planning. Probably just going to reflect back to members. This is it's always been a kind of really hot topic for us. Probably just been accentuated after the kind of last set of figures that I've just seen around their absence position. So I think in terms of our planning, we'll look to kind of pull that into a session around workforce. We'll have a look at the kind of calendar and see which kind of opportunity we've got next in terms of development sessions and planning for that accordingly. So hopefully that we can move that on to a green position from that. So hopefully that's acceptable to members. So that's okay.
Do you know, just going back to the sound quality, has it improved? No.
Yeah,
Difference?
I can hear you better.
I can hear fine as well.
Right.
Well, I can't. It's
Okay,
less fussy, more echoey.
in terms of item 2, reducing the harm from drug and alcohol use report, so that is down for June this year. So we should be on course for that. Catherine's not here today, but kind of the commitment that will be on course for a June kind of discussion on that. So hopefully that's okay. And then we've also got the kind of risk management side of things. Again, similar to what I just said about the development sessions, we need to kind of have a look at our timetable going forward. I know we've got some identified sessions with topics already, so just make sure that over the course of this year that we've got each one of those particular aspects kind of picked up within one of our development sessions. So again, for 8 and 9, that would cover those particular issues. And item 10, which I'm not sure we've not really kind of got a time frame and a status on. I think that's a conversation that we can have. We're starting our budget planning for 27-28 already, and again, with the Dundee City Council colleagues are doing the same, so that will kind of run parallel with that conversation. So hopefully we'll can update that properly for the next action tracker, so it's not lost.
Yeah, we've got a wee while yet because we're starting a budget meeting, so yeah. Okay, thanks for that. Next item, please.
So that then takes us on to item 4, which is the joint inspection of adult services in the Dundee Health and Social Care Partnership findings and improvement plan. You have a report from Noting, but there will also be a presentation.
Yeah, I'd like to welcome everyone here who's come along to make a presentation, and I have 4 names. I'm assuming that you're all here. Gillian Parks-Wilson,
Here.
Dundee Health and Social Care Partnership. Shannon Jackland from DVVA. Colin Mason, Colin, yes, first welcome, and also Paul Byrne from DVVA. So really good to have you here. We like to have presentations, particularly when there are less items on the agenda and we've got plenty of time. So if you'd just like to make your presentations, I have them in a particular order, but whoever wants to go first, it's up to you.
I was going to say, what was you going to do?
Or are you going
No, it's fine. What we can do, I mean, this item, so the report itself is around the outcome of the joint inspection. I'm really pleased to see such a positive outcome from the inspection. Also, colleagues have seen this before. I think what we'll do, if you don't mind, then is I think the focus should be on the great work that kind of has led to the inspection. So I think if we can pass on to the team to kind of pick up and do the presentation, and we can come back to the actual report itself. That's okay.
Yeah.
So over to you.
Sounds good. So I'm going to, what we've just decided to do is focus on the good practice areas that are noted in the report and give a wee bit more detail around them. And I'll just check the sound quality. Can people hear us? Because we're sitting at quite a different position from other speakers. Does that sound okay? So I'll speak around the collaborative work, which is noted on page 29. Shannon's going to speak about co-production. Paul will speak about peer work and some more around co-production, and Colin will speak around peer work in a bit more detail. We've got a few minutes each, and we're open to take some questions around our presentations. I don't have one on screen, but I know some of my colleagues do. So in 2014, there was a report from the providers, the partners, and what will it take? That was Kip and Reid, and they highlighted that the demand for social care was increasing when available resources were reducing. And the conclusions of that report were clear that meeting those challenges would only be possible by working better together, by working collaboratively. And at around the same time, there were some changes in legislation which created opportunities for greater collaboration between commissioners, the people we support, our providers and the community. And since 2016, Dundee has embraced this opportunity. So in 2016, Dundee Health and Social Care Partnership constituted a provider collaborative, initially for learning disability and autism, but we later expanded to include mental health provision. And it's important to note that prior to its formal establishment, there was a strong local appetite to develop a more joined-up approach to service delivery and to better connect individual services. So the collaborative brings together Dundee Health and Social Care Partnership and a range of providers who are all committed to working collaboratively to meet the needs of the people across the city. So like all collaborative work, it's built on trusted relationships and a strong shared vision to provide excellent support to the people who we are seeking to support. So from the outset, the intention was to support a shift from competition to collaboration, and we've sought to do that through open discussions, transparency and a sort of new approach to decision making. And that included exploring different ways of commissioning the new developments in the services. We look to take account of provider capacity, the strengths, the local knowledge and any added values. We do have our terms of reference for the collaborative group, and we do have good governance and learning around that. And the terms of reference are reviewed annually to ensure that the group continues to operate to a high standard and follow best practice, and to ensure that we align with the partnerships updated, like the recent reviewed procurement guidance. So it has proven to be exceptionally successful. You know, it's not only noted in the report, but there has been local feedback as well as national interest around what we do and the impact of it. It's been particularly effective in relation to the developments that have arisen from the Strategic Housing Investment Plan, which is often referred to as the SHIP, and around 8 new build developments across the city have already been part of that process, and decisions made around who would provide the support, and that is for learning disability and people with mental health who live in more homes that have been built, but they require a level of social care support. But we think that the provider collaborative demonstrates how collaboration, co-production and partnership can work and be translated into practical system-wide change, and that it does actually deliver better outcomes for the people who we support, and that the services are more sustainable. We have been established now and up and running for, that's since 2016, so it's quite a while. We're almost 10 years into the process, so we have sustained this work throughout the pandemic, etc. And that's the end of my comment on the collaborative.
I'm assuming that everyone who's making the presentation is happy to take any questions. I haven't seen the notes from one yet. Are there any questions for Gillian? The one part that I really liked about what you said was competition, collaboration as opposed to competition. I really liked that because really we'll get better outcomes from collaboration rather than different agencies competing with each other.
Yeah, it's a holistic approach, Ken, and we're all trying to meet the bigger picture of greater needs.
Yeah, yeah.
Dave, just valid comments, because thanks John for taking us through that, because you see from that from the report, it's such a kind of key strength in terms of our sort of our commissioning approach, and that's something that's been recognised not just locally but nationally in terms of the approach that we've taken in Dundee, and that's not, as John says, it's been something that's been quite a long time in the making, but we continue to get the benefits of that just now, so stick close to that.
Thank you. Sharon, I noticed that you have slides, but are they going to come up on the screen? Or?
Paul, you would go.
Paul's going to press the buttons.
Okay,
right.
You just have to tell me when.
No, it's the purple one. Be in that window, Paul. I think it's just a different tab at the top. Pick up.
Oh, no, excellent.
We can see that, yeah.
Okay, hi folks, thank you so much for having us today. I'm Shannon Shankland, I'm the Mental Health Engagement Coordinator at Dundee Volunteer and Voluntary Action. So I'm going to give you a little bit of context about co-production, as there was lots highlighted in the inspection report about co-production. So I'm going to talk a little bit more in detail, and then my colleagues Paul and Colin are going to talk a little bit more about how we might see that in practice and things. So, right, Paul. So to give you a little bit of context behind our team, there we go. So we are the mental health and substance use team. So we're made up of different roles. So we have Alan, who's our team manager, myself. We also have Gabriel, who does a very similar role to mine, but focusing on substance use work. We have Ben, who coordinates a third sector mental health forum, which brings together partners from across the city who have an interest in mental health, and they come together every 6 weeks. We have Paul, who will tell you a little bit more about himself in his presentation. We have Ross, who is our communications and engagement worker, so he does lots of filmmaking, he does lots of media and graphics that we use as part of our co-production. We have Michael, Rosie and Megan, who are our engagement workers, so they're out in the communities working with people, directly meeting with and building those relationships. So that's just a bit of an overview of our team. So co-production, I wanted to start with a little definition of what it is. So co-production is a way of working whereby citizens and decision makers, or people who use those services, families, their carers and service providers, work together to create a decision or a service which works for them. The approach is value-driven and is built on the principle that those who are using the service are best placed to help design it. So that's at the heart of co-production, and that's at the heart of the inspection report. There are lots of pieces of co-production throughout that inspection report which puts people in a position to help make decisions, and that's what my role is about. It's about ensuring and empowering people of lived experience, their carers, their families, their networks, to be meaningfully involved in the decision-making process around mental health. So I'm going to give you a little bit of an example of one of the ways in which we've done that in a little bit more detail, which is the development of the mental health and wellbeing strategy for the city. So this little infographic shows you our work over the last year. So we started last April, where we had a large-scale event. This had over 90 people come along on the day, and we had conversations. We looked at a "you said and here's what we've done" approach. So that was an opportunity for the partnership to kind of tell folks what we'd been up to, and also to get their opinions, their views throughout that. We then produced 2 reports following this. So the reports detailed everything that was said by all those 90 people on that day, and gave their testimonies, their stories, their views, and we looked at that and we picked out key themes from that, which then helped lead the process going forward. After that event, of those 90 people, we had 81 people say, "I would like to still be involved in this going forward." So we did that by stakeholder group, so we met every 6 weeks. And we looked at those themes that were highlighted from that main event. So some of those were things like workforce development, communities and localities, care and treatment, navigation and awareness, how people get that information, how they access it. And all of those themes, well, you will see hopefully in the final mental health and wellbeing strategy. So we also went out to reach the general public. So that first photo you saw of the team were actually in Dundee City Centre, asking members of the public their opinions on mental health. We had 55 people from the general public stop and answer our surveys on the day, which was really good. So we're based in the Overgate and the Wellgate, and we were on the beside Desperate Dan. We've also done outreach to the local community spaces. So we know that people go where they feel comfortable, so our engagement workers have been out meeting with them where they're at. So we've been to 9 different organisations, meeting over 160 people to get their voices. Some of those partners being, I don't know if I've put them on this slide, but we went to places like Wellbeing Works, we went to places like Dundee International Women's Centre, all over the place in Dundee to try and get as many views as possible. And we've been closing the loop throughout, so that's a really important part of co-production, which means we're giving people feedback the entire time so they can see what the processes are and influence what the next steps are. So over the last year, we've almost met with over 500 people to get their input and their views into this process, and made sure that everything that they've said we've either actioned or we've given a response as to why that can't be actioned, to kind of close that loop and to make sure people can really see where their stories and where their views are being incorporated into the process. So what difference has this made? Well, I've popped a few quotes from our stakeholders there, which I'll get on to. But we've met nearly 500 people, so that's almost 500 voices are in this one document. The process has been shaped by lived experience voices, whether that's their own personal experience, whether that's family carers, whether that's people who work in the sector, professionals in the city. And some of the quotes were things like, "There's been ample opportunities to have your voices heard. People have said that our team have been committed to ensuring voices were heard and kept on track so that stakeholders felt that what they were saying was meaningful. The process was completely tailored to what people want. And stakeholders really felt that they'd been able to shape the future of services through this process. So it's really important for individuals and families to feel involved in that process, to be meaningfully heard and respected and treated as equal partners in making decisions. This creates a space to empower, to encourage ownership, trust and participation from people. So what are our next steps? So, like that, we have had people give feedback in a number of different ways, and we've also fed those back in a number of different ways. So this is just a little graphic at the side that we shared with stakeholders. We've got quotes from them, we've got pictures, we've got parts of their stories to feed back and let everybody know what the conversation was. Again, we've had that two-way dialogue and conversation throughout, so it's been shaped every step of the way from what people have said and what they want to focus on. We do have a final draft of the document which has been created. It was out to stakeholders and closed last Friday, so again they have done everything from the vision statement that's in the document to the layout to what pictures go where. They have been involved in every part of that. So we were taking final comments from our stakeholder group, which closed on Friday, and I hope it will come to you guys very soon so you can see the document that's been produced. So just another example that you might be aware of, you might not. So another piece of work that we've been working on is the People Bereaved by Suicide project in the city. So this was actually highlighted by Suicide Prevention Scotland as a good practice example for Dundee. And this service was looking at the people who have been bereaved by suicide within the city, their loved ones, their families, their carers, their wider networks coming together to share their experience and what they might have needed in terms of support. And we now have a service which has been co-produced and designed by people that is sitting with Hope Point. So there's peer workers who are able to support people following a bereavement by suicide, and that's really been shaped by people sharing their stories, and that service is now up and running and there to kind of support people. So yeah, it's worth having a look at the case example for that. That was just another highlight as we go. So yeah, co-production has really been at the heart of everything that we've done. We're very, very lucky that the Health and Social Care Partnership have built in co-production at every aspect as much as they can, so that people are really able to be involved in that decision-making process. And Paul, you're going to speak a little bit more about how we might see that in practice and developments. But yeah, that was a whistle-stop tour of co-production at the moment in the city. So thank you so much.
Thanks very much. Could you maybe, so I can see if there's any hands up. Thanks very much for that, Sharon. That was really interesting. I've been at many engagement events over the years, not just as a councillor, but when I had other jobs, and whilst they were valuable on the day, I never really heard that much about it after them. But it seems that in this case you've really followed through on that engagement event with, I like the 6 weekly meetings that you've not allowed things to drift. You've engaged with just under 500 people. You've given an example of what a new service has really come out of co-production. Really impressed, and thanks for your presentation this morning. I don't have a question, but I just wanted to say how impressed I was with all the work that's been done. Thank you. I noticed, yeah.
Hi, I'm Nicola. I'm the service user representative here at Dundee IJB. And Shannon, I just wanted to echo what Chair was saying there. That was a really excellent presentation. That was probably the clearest presentation I've heard about co-production. It was really excellent. And there's a couple of things just to note on it. The outreach efforts and the reach have been extensive and very successful from what you're relaying. I really do look forward to reading the full report in due course. What I particularly like is you relaying the clean feedback, that I'll call it, in your co-production approach. And what that means to me is that you're reporting what was actually said. And I love the closing the loop. So you're giving people an answer, you know, or a response, as you were saying, for why something's not getting taken forward. What I hear again and again was nobody's listening. Now that's maybe just in a general context, but nobody's listening. I've said this umpteen times, nobody's listening. So I think that closing the loop and the responses is really clear, and I think that gives Dundee IJB, you know, great assurance of the approach that you're all taking, you know, within the team. So thank you very much.
No, thank
no questions because you've dealt with them all.
No, thank you. Like that, it's co-production is a time-consuming process. We're very lucky that we are a team of 9, where we can dedicate that time to. It's built on relationships. It's built on people trusting that you can take their story and it's not just going into the ether, into nothing. So we really value those relationships, and it's so important for us to feed back throughout. That's before we've even spoken to someone, we're thinking about how we can get back to them. So no, thank you very much for your comments.
Colleague, would you like to come in?
Yeah, very, excuse me, very similar to what's already been said. Aside, you're also tiny on my screen, so if I ever see any of you, please say hello to me because I can't see what your faces look like from here. Yeah, absolutely incredible. And I think that it's really true co-production. It would have been very easy for you to have that engagement event in April last year and then just say, that's fine, this was co-produced, you know, we can write that on it. But to actually follow up with the 6 weekly stakeholder meetings and get back to everybody, it's just the perfect example of true co-production. And I think that's what shines through in this report, is that it's been really meaningful, and that's why we've got such exceptional, you know, evaluations as we did. This has already also been through clinical governance and NH&S Tayside, and everyone there was really complimentary about it as well. Very impressive. My only question is, can we get a visit organised to you guys, to Hope Point, just a kind of little day, because it would be great to get out and about if we could see what dates kind of everybody could do and meet you all properly instead of a tiny little person on my screen.
Absolutely. I mean, I will speak on behalf of the team. Absolutely. And yeah, we can, like that, we work with a lot of our partners across the city, whether that is Hope Point or whether that's kind of Veterans First Point, all of our kind of different partners. So it would be really good for, like that, when you're not in it and seeing it every day, it can make it quite difficult to kind of get those real life stories behind things that are in reports. So absolutely, please, you're all invited.
Thank you.
I think next, Dave, do you want
Yeah,
to...
no, just want to add something there as well. So again, thanks, Shannon, for the presentation. And in terms of the feedback from the inspectors themselves, when we were in this very room, and they were kind of saying this is what we found, when they talked about the voices and the kind of the sheer number of people who wanted to talk to inspectors, which is something they don't actually kind of see very often. I don't think it's an accident that because of the approach that's been taken, that kind of the collaborative approach that people felt, yeah, I'm a service user in Dundee and I know that people want to hear my story, so I think that's going to, but although that was something that, just to say, I think the inspectors are kind of really, we'll say, I think it was about the second highest kind of engagement that they've had through the SWOT inspection process, so just acknowledge that as well.
Yeah. I think I need to check my list here again. I think you're up next, Colin. Yeah,
I think
Paul's. We'll do a switcheroo and I'll press the button for him.
I have to say at the start, whatever order you like, I'm now trying to order. So sorry about that. I will.
Sorry, it's hidden by that bar at the top. I think we're somewhere around here. Come on. Oh my goodness.
I think we need Paul's technical expertise back here.
If you minimise the chat at the side, I think.
I got it there, look, did you see it? And then it went away. It's stuck under here. All hell.
Do you want to try to stop sharing just now then?
No, it's it.
Yeah, I can maybe, hang on. Let's do it this way. Good idea. There we go. Right. Sorry guys. I'm good at co-production, I'm not good at IT. There we go. Right. And I make it full screen now.
Down the bottom.
Just try it.
Right, did you say? Yeah, I don't have my glasses on. There we go, look. There we go. Right guys, sorry. We're there.
Right. Hi, good morning everyone. Yeah, so I'm Paul, I'm peer support development worker at EVVA, and been asked to kind of speak a little bit about the Dundee Peer Network and some of the co-production that went into developing that, as it was something that was highlighted as well in the inspection. As far as I'm aware at the moment, it is one of, if not the only, functioning peer network across Scotland, and has been highlighted in the inspection and through work with the Scottish Recovery Network, etc., as being a really good example of good practice for developing a peer network. So basically, yeah, just a quick overview of this. We as coming into the role just over a year ago, the awareness of this network and the beginning of the relaunch, shall we call it, was basically done by your classic. It was emails, it was phone calls, it was chapping on doors, it was literally getting out and about, spreading the word, going around to as many different organisations within Dundee who utilise peer support, and then trying to get them involved. And again, that just really relied on building connections one-to-one with people, getting out and about, like Shannon said as well, meeting people where they are. Not expecting everyone to answer emails, as we know people are busy, or come and meet me there. Getting out and about to services and learning a lot about all the peer support in Dundee. We also utilised some of the mailing lists that we have at DVVA, so for example, the mental health mailing list, and also attending third sector mental health forums and the meeting of recovery services to really try and promote the benefits of bringing people together. As you can see on the screen as well, there was also a wee flyer developed, a QR code and an email address that was delivered to as many services as possible to try and encourage people to come along to the launch of the peer network. And again, the launch of the peer network was very much promoted and set as an opportunity for people who are involved in peer support to come along and shape what the network would actually look like.
Why is it making a noise?
There you go, pardon me. So the event was, pardon me, oh my God, should have a glass of water. No, I'm all right, I'm okay now, fine, thank you. So basically the event was framed as, you tell me, it wasn't a case of, I'm launching a peer network, this is what's going to happen. This was very much, what would you like to see in a peer network? So people were given multiple questions to answer, and it was very much, flip charts, sticky notes, let's get in and see what people want. So it was, what is the point in a peer network? What do you want from a peer network? Do you want gatherings? Do you want online gatherings, in-person gatherings? We also discussed, how do people communicate between the peer network? How can that help support the well-being and the wellness of people involved in peer support? How can we help support people looking to get into peer support? And also, what are the core values and culture of a peer network? As peer work is very much a value-driven profession, where it is very much based on core values and principles, what does a peer network look like? And as you can see on the screen as well, some of the key themes that we pulled out of that were things like a monthly newsletter, how we share best practice between different organisations, information sharing, awareness of other organisations and services, what kind of peer support they provide to people, gatherings every few months. Some people wanted formal gatherings, some people wanted informal gatherings, and making sure it was a welcome and inclusive, respectful environment. So off the back of that, we tried to cater as much as possible to what people had said at this event. So we now do a mixture of events, so we'll have a monthly, as you can see, a wee coffee morning and / kind of co-reflection space. This is a very informal drop-in that people had asked for, so that morning it's literally me sitting in a room with a bunch of coffee and some breakfast items. Anyone involved in peer support is welcome to come in, drop in, have a chat with other peer workers, chat to myself. It can also be, people who are already in peer roles, but people who are looking to get into peer roles can come along, do a bit of networking, meet other people who are already involved in peer support and find out just a bit more about other services and what it involves to become a peer supporter. We also have a newsletter that goes out every month. Again, this was something people had asked for, really to raise awareness for things as, are there job opportunities, are there volunteer opportunities for peer work, are there any training sessions that are coming up available across Dundee that would help develop you into a peer worker, or if you're already in peer roles, help strengthen that practice. As you can see, again, it's also highlighting, national events that are happening in Dundee, and just general awareness of everything that's going on a monthly basis to anyone who wants to be or is involved in peer support. Again, much like Shannon was saying, this is not something that just happens at the start of a project and we take their feedback and then it's just kind of like, got a network now and we go. This is something that we try and involve people in the decision making and how it will look going forward. So whether that's through anonymous surveys to find out what people want, is it working, what's not working, and also we were very lucky to have the Scottish Recovery Network, who are the nationally funded service for peer support across Scotland, come in and do a wee focus group at the last peer network event that was held at the Wellbeing Works, to really get that feedback from people who are involved in the network. What's working, what isn't working, what do you enjoy about being part of it? And it was also really lucky that as part of that, I've been involved in developing an outcome mapping tool which will help evaluate peer support in all its different ways with the Scottish Recovery Network. So we were kind of the guinea pigs for that as well, for a peer network, kind of due to the fact that, like I said earlier, we're pretty much the only functioning one across Scotland at the moment. So we were able to gather voices of people who are involved in the network to really find out what benefits they get from it. Really trying to pull out some kind of tangible, value-based feedback, that isn't just how many people are coming to the how many people are coming to the network. It was really to try and dig into, well, what's the purpose of it? Are people enjoying coming? What are people getting out of it? And off the back of that, they pulled out 3 main outcomes regarding the involvement in the peer network that people have found. So psychological safety and acceptance was a big one, and it really showed that it's helping and supporting the psychological conditions that peer workers require to be able to thrive in their roles. And they said this was significant, as peer workers often work in a challenging emotional context, and without a safe foundation of safety and acceptance, other outcomes such as like learning and practice improvement just aren't possible. Outcome 2, recognition and value of peer values and lived experience. This was a big one as well, where they really found that legitimising and professionalising peer work while also keeping it rooted in peer values and lived experience. And again, from the report as well, it shows that it's helping to build the capacity to be an effective peer worker and to help advocate for the value of peer support in wider systems. When peer workers can understand what peer support is and they feel confident in their practice, they can confidently and effectively champion it with statutory partners, employers and policy makers. And the final outcome they found as well was connection, which leads to growth and improved practice. So again, they said this was significant as it shows how the network is now creating a sustainable capacity building. So the peer network is not just people attending meetings, they're also learning about opportunities, reducing barriers to employment, learning best practice through working with other organisations, developing confidence and championing peer work across Dundee. And again, just in general, I think this has all been, it's all very much driven by, again, the people involved in the network. I find my job is very much gathering those voices and putting it into practice, and we've been really lucky to get such good buy-in by lots of different services across Dundee and third sector organisations, and also like NHS as well. Been really good in getting involved as well. We've had a lot of good buy-in from them, which is just great as well, because there's peer work going on in NHS, third sector services, and being able to bring them together to try and pool that best practice and get that information from everyone has been really beneficial. And just lastly as well, on the back of the peer network development as well, that also involves a peer framework development that we are doing as well, which was a funded piece of work that we charged to do, and that has been, everyone, that has been very much driven by those members of the peer network. These people are coming together every month, forming a working group to help develop content that will develop a guide for peer practice across Dundee that anyone can use, can utilise this guide when it's finished, from bringing in peer support into your service, what to do to prepare that, how to support peer workers, how to develop peer work, and obviously the goal with that is to really help embed peer support across all services in Dundee and really help shine a light on the benefits of peer support, but also by doing that, by bringing together those voices of those involved in peer support in Dundee.
Thanks very much for that. Having really heaped praise on your colleague over there, I'm going to heap further praise on yourself for the fantastic work you've been doing. Really thorough presentation. Again, I like the amount of flexibility you're showing, because peer support is so important and so beneficial for those providing it, for those receiving it, and it's very important that peer workers feel supported. So thanks very much for that. Colleen is the first hand that I see this time. Colleen.
Yeah, just another quick comment. I mean, it goes for everybody that's speaking today to say how incredible this work is. And the fact that with the peer support network that's leading the way in Scotland, that's absolutely incredible. And just for peer support workers to never be undervalued. Any places that I've visited where there's peer support workers there, the staff and the people using that service always say, oh, actually, there's this peer support worker here. They make all the difference. And it's just incredible what somebody who has lived experience can bring to something, that genuine understanding. And yes, just congratulations for all the work.
Yeah, thanks for that, Colleen. Yeah, Nick.
Oh, great presentation. Thanks ever so much. And I didn't know much about the peer support network before, so you've articulated that exceptionally clearly. A couple of things kind of stood out for me. The frequency of when you're bringing people together, I think that's really important, so you can miss one, but it's only another month before you can kind of come back together again. A huge amount of work has gone into it, and I think a key thing is evaluation. And, again, you've done that well with the outcome mapping tool that you've developed, so that's fantastic. And supporting peer support workers' well-being as well as a professional development, yeah, that's just fantastic.
If you are interested in the evaluation tool and peer support as well, I might as well just plug this as well. I think it's just at the end of the month, there's a Scottish Recovery Network event where they're doing a roadshow of the evaluation tool. It will be held at the DCA. You will get a nice lunch as well. If you're interested, I'm sure there's still spaces available on Eventbrite. Be happy to share that with you if you'd like. But they're basically doing a Scottish roadshow, as they're calling it, where they're going to be presenting this adaptable outcome mapping tool that can be used for individual peer workers or peer organisations. But also, we were the first example of using it as to evaluate a peer network, and there will be a report that they're generating off the back of that as well, and I'd be happy to share once it's complete as well.
I don't think there's any further questions, so it's over to you, Colin, for the final.
I'll apologise that we don't have a fancy slideshow.
That's all right.
Yeah, Colin.
Right, so yeah, I'm Colin. I'm a veterans peer support worker at Veterans First Point, based here in Dundee. For myself, I've got 33 years of military experience, both regular and reserve, and that gives me a unique picture on some of the veterans that we support and the problems they face. I have done operational deployments in Bosnia, Northern Ireland, Iraq and Afghanistan, so I've got a wide perspective of different conflicts in different parts of the world. So within D1D, we're quite a small team, led by Dr. Michelle Ramage. We've also got Dr. Duncan Davison, John Webster and Patrick Santry. So they provide our psychotherapy therapists overwatch, and it's quite good having them within our team, because when the veterans come to us and they need therapy, it's a quicker avenue to get that therapy than going through the normal channels within the NHS. As another peer support workers, we've also got David, he's ex-Navy, and Christine, who's ex-RAF. So we've managed to cover all three services. But that doesn't mean that we only look after people from our service. We look after everybody who comes in. And we've also got Laura, who's our administrator. So there's 5 V1Ps left in Scotland, ourselves in Tayside, 5 in the borders, Lanarkshire and Ayrshire and Arran. There was a 6th one down Lothians, but that closed last year. So we don't cover the whole of Scotland. So if you're outside of these areas, you don't really have the support that we can provide. You have to go to other organisations. So inside V1P Tayside, we've been running since 2015. So it's been 11 years this year. And we're based at one of the hospitals, King Cross Hospital in Dundee. So within the veterans community, we provide accessibility to the veterans. So that's, we can do online communications like we're doing today. We also do outreach. So we go and visit the veterans who can't travel where they live across the whole of Tayside, which includes Perth and Kinross, Angus and Dundee City Centre. We also work with other organisations like DVVA, SAFA, Poppy Scotland, British Legion, to give an overwhelming package, because we can't provide everything for them, but being a voice for them, we can reach out to these other organisations. Like I said, we've been going for 11 years, and within that gives us a certain sense of credibility because we've got longevity. We're not just one of these services that just popped up overnight, maybe last for a couple of years and then disappear into the ether. Within that, we've got lived experience of being in the military, which is a unique and experience way of life, which if you've never been in that environment, it's hard to comprehend some of the things that goes on. And we also, recently, last year, I did a thing called PDA, Personal Development Award. So that's a level 7 SQA in mental health. So we're doing the qualifications, we're doing further development in different areas, just to give better support across the board. And like I said, we coordinate with other organisations. We signpost the best people that can deal with situations that they might find themselves in. And we also attend multidisciplinary meetings with other organisations to do in-depth discussion about certain cases where the needs are so complex, we need other services to come and help us give support. So some of the issues we look at with the veterans that are coming to us, we've got childhood experiences or ACEs, homelessness, PTSD, trauma, drink and drug addiction, financial stresses, relationship breakdowns, disability, bullying, of sexual nature, verbal, physical. The military, until the mid-90s, it's illegal to be gay or lesbian. And if you were caught, it meant automatic discharge. Occasionally that meant time in military prison for carrying out an illegal act. So we deal with all that. For the females, the military is a male-dominated environment. So you've got all the complexities that brings to females. When the service leavers rejoin society, it's trying to integrate back into civilian society. You've been away. For myself, I did 22 years in regulars. I come back to Dundee area. I knew nobody. Couldn't get a job. Struggled. Managed to find some place to live, which was a good start. And I got lucky. I joined the Army Reserves in Dundee, which gave me employment, helped me pay my wages. For some of the guys coming back, they can't make that connection. So they're left within society adrift. Another one, lack of experience. I got asked when I applied for jobs, what experience you got? Here's my CV, this is what I've done. No, what experience you got doing our job in Civilian Street? I joined when I was 18, I left when I was 40. I've got no experience in Civilian Street. But nobody's willing to give you that chance. Life skills, budgeting. Army doesn't teach you how to budget. They take your accommodation off you when you first get paid. The rest of the money is yours to do what you want. When you come to Civilian Street, you've got sorted bills. I had to ring my mum and ask her to sort out gas and electricity, because I never had to do it. And the big one they've got is a loss of purpose. In the military, you've got a job, you know what you're doing. If you've risen through the ranks, you've got command elements, you're looking after other people. You know what you're doing because you get told. 8 o'clock in the morning, you're going, dress for PT, you're going a 3-mile run. They've suddenly lost all that. Nobody tells them what to do, give them direction. So we've got these people coming in with all these complex problems, right? So we reach out, you know, we engage with other organisations, we help the veterans, but most of the time we listen. Because a lot of them just want to talk to somebody. Somebody understands them. And having that military experience gives them somebody they can talk to. Because they don't have to explain things. They don't have to talk about what's like being in Afghanistan, what's been like in the Falklands, because we do have quite a lot of Falklands veterans we're supporting just now. Because we've been there. Maybe not in that scenario, but we've been in that environment, so we understand. And like I said, with the Falklands veterans, the people we're supporting now are not Afghanistan veterans. We won't see them for another 10 to 15 years as they get older. Their lives have changed. They do get out, they've got a house, they've got a job, they're raising a family, everything's brilliant. And something comes along, they get divorced, they lose their house, lose their job, they retire. Suddenly they've got nothing. And now they're left with their thoughts. The things they've buried for all these years now come back. So we do see a lot of older veterans coming through. The younger ones, like I said, we see occasional ones, but most of them we won't see for another 10 years. Which means that we need this longevity within our service and the veterans community as a whole to be there for them. So the sort of support we do, like I said, we signpost, we've got lived experience based on our own experiences, which we can convey across them with empathy, not sympathy. And that's, I understand, I've been there, I know what you're talking about, rather than saying, oh, I'm so sorry to hear that. Right? We understand, we've been there. So within ourselves, Veterans First Point, we are a small team. We do cover a very large area. And what we try and do is be there for the people coming to us for support and try to do the best for them. And just, I don't know, give them the support they need to rebuild their lives if that's what they need. And live a proper, fulfilling life within society. And that's all I've got.
Yeah, thanks very much for that, Colin. You've really outlined and made me think about a lot of challenges that veterans face, because I've never been in the armed forces. But you have, and I had 22 years, or you said 33 at the end.
Yeah, so I did 22 years in the Royal Logistic Corps as a regular, and then I come out and joined the reserves, partly because I couldn't get a job anywhere else. And they gave me a job. I did 8 years on contract with them, but the last 3 years I've been working with Veterans First Point within the NHS, but I'm still in the reserves.
So it's 3 years in total. I think that gives you a unique insight into the challenges. I think you're so well placed to be delivering support to veterans. I think you have credibility amongst veterans as a result of that. You certainly have, to me, because that 33 years is a very long time in terms of service. So I think as the Americans say, thank you for your service.
Thank you very much.
And thank you so much for the support that Veterans First Point are providing. And again, an example of a very flexible service that's prepared to go the extra mile and make it easy for people to engage that need the support. Great stuff. And I'll see who else wants to ask a question and or make a comment anyway. Dorothy, Councillor you.
Thanks, Ken, and thank you, Colin. You're doing really good work. This is something I didn't know very much about, and that's been really useful today. And I'll add my thanks to Ken's for your service. I'm wondering what support is available from armed forces organisations, if any. I guess if it's available, it's not adequate, since we wouldn't need people like you and your organisation doing what you're doing. But is there anything available, Colin?
Yeah, so we are just a small team within the mental health. The military in itself is getting better. It now realises a lot of the soldiers they've got, military personnel, service personnel, are leaving because they can't cope. But they realise now that if they deal with the mental health issues they've got at source, a lot of these people will then be able to continue their service rather than just get out. So the military is getting better. It's doing this at ground level. When they come out, there is the organisations like SAFA who can provide monetary funding, help them.
What if they want to co-op? So that's make me think it might be a test track. Perhaps we should. It's definitely a test track. I want to talk about anything.
It's every Wednesday, maybe I was like, look at time because I wouldn't want this to happen during every Wednesday meeting, because we're always Wednesday. Now that we're back in person, but anyway, sorry, I've lost the thread maybe because of that. Yes.
Yeah, so things like SAFA, Veterans House, Scottish Veterans Housing. We've got one in Dundee called Rosendale. There's one in Edinburgh, Whiteford, and there's one in Glasgow. They can provide temporary housing for veterans. It's they have a room, shower facilities, they get fed, and that's all encompassed under the universal credit, which they're entitled to apply for. You've got Veterans Housing Scotland, who do find proper homes for veterans. Because they're maybe struggling financially, SAFA can provide basic white goods, carpets, and that sort of stuff to help them, make a home for themselves. Same as British Legion, Poppy Scotland. So we all integrate to one another, talk to one another to help solve problems for the guys that are coming, guys and girls that are coming looking for support. It is out there, but if you don't know, you just don't know, unfortunately.
I'll bring in David Cheap next.
Yeah, thanks, Ken. I'm going to ask my other two NHS Tayside colleagues, Bob and Colleen here. Am I right in saying, guys, that Sam Riddle is Veterans Champion on the NHS Tayside board?
Yes,
yeah. I think it'd be useful because that was very eloquent and really quite insightful, and I think it'd be good to maybe link up with Sam as a non-exec member of NHS Tayside, who is Veterans Champion, and would be really, really interested in all that you've said. And again, like Colleen has said earlier in today's meeting, maybe to set up a meeting there at some point would be quite useful. It just gives it broadens the reach of your work and brings it right into board level at NHS Tayside. So I think we'd be really interested in that, if we can maybe get details and get a link up there.
David, I think that James Cotton is as well Armed Forces Champion. He has some kind of role.
Right.
I think it's
Okay.
Sam and James have both got. I might be wrong.
Maybe if we could get details, we could look into that our end and perhaps marry up for some sort of meeting, if that'd be possible.
Yeah, definitely. But we do go to road shows like the Scottish Recovery Network and other areas to highlight our service and make it known out there in the wider community that we are here for the veterans. So any sort of way we can highlight our service is brilliant.
Well, maybe if you don't mind, via Arlene or there, you could perhaps get your details passed across to us, and we can take it further from there.
That'd be brilliant. Thank you.
David.
Thanks, Ken, and thanks, Colin, for that. That was great to kind of hear that, the kind of breadth of what's covered. I was going to say, David, I can pick that up because I can pick up with Sam and James and make that connection as well. So make sure that we can.
Excellent, thank you.
Apologies for the one thing I was wanting to kind of add. There's a little bit kind of more context for IJB members. Ken, you've obviously been around for a while, but some members might not have been around.
Been around for a while, all right.
Talked about the 11 years since Veterans First Point was created, and I do remember, because we've been around a while as well, I do remember that coming into being, and you know, it was, as Colin says, there's now only 5 left in Scotland. So I think it's probably a testament to kind of previous IJBs and the current IJB in terms of that commitment to continue to kind of fund and funding towards this important aspect of our work. In terms of context, when it was set up, it was 50-50 funded between the Scottish Government and ourselves. Over time, the Scottish Government's funding has never shifted, so it stayed at the same value. So I think that the kind of investment is now somewhat, I'll put the Chief Finance Officer on the spot, kind of shifted to probably more around the kind of 70-30 split. So I think it's important for us as we kind of have all our sort of financial challenges and the discussions around kind of where we go next, that we kind of recognise that investment that we've continued to put in such an important kind of service to our communities. So just to get a bit of context for our IJB members.
I absolutely agree with that. It's a shame that this service has fallen by the wayside in other parts of Scotland. We need to ensure that it doesn't here, particularly after having heard your presentation today. And that's why presentations are so important, because we're presenting, this is a relatively small set of papers, but quite often we're presenting with a very thick set of papers, and we don't go through the paper, but we don't hear from people providing services. It's really helpful.
Thanks, Colin. I was sitting with goosebumps listening to you, because I'm the wife of an ex-body who's been in Northern Ireland and Falklands. And what you were saying about their experiences, I've heard it, yeah, absolutely. You know, and it does affect them going forward. I've got a couple of points just to make. I think the central point of expertise is absolutely key. Of course it is, and their experience shines through, obviously. I probably want to build on the reach aspect that was going on with other comments. How do you get people to know about your service? What's the reach? How do they get to know about you? I've done a quick Dundee veteran support, and you do come up second there. Yeah. So, but you do come up there. So, and I hadn't heard of the organisation before myself. I particularly wonder about, you know, how do GP practices across these
so
about your service?
we do get a lot of referrals coming in from GP practices, because we have been out there, we have pushed ourselves out there. We get self-referrals, so just now we're on the internet. If you put in D1P Tayside, it comes up. We are on the NHS search as well. That needs updating, as we found out yesterday. Yeah, so we go out and do road shows, take part, ourselves out there. A lot of veterans, like I said, self-referral. We get them from GPs, SAFA, other organisations. Just anywhere where there's a veteran's highlighted as some different place. While like things like DDARs and that will help them support on that side, it's often the root causes of why they have to go to DDARs that they can't support with. So that's why they come to us. But we get referrals from all over. It's quite Laura's got quite a hard job watching the emails come in and referrals and that sort of stuff.
Thank you.
So thanks to our 4 presenters, is that the right word? Presenters. It's been really valuable hearing from you all. I have been shown how much we've valued it by the number of questions and comments. Would you like to kind of wrap up then on this item today, with any comments you'd like to make? But what is a very encouraging report? Yeah, I have to say. Okay, over to you.
Thanks, Chair. So So the report in front of you just kind of provides IJB members with an overview of the outcome of the inspection report and also the improvement plan that's been developed in response to the inspection report as well. As we've heard today in terms of presentation, so much good work across the city through the partnership that's going to lead to kind of really good outcomes for individuals, and ultimately that's what the inspection was about. It's not an inspection of our services, it's about the kind of the outcomes that individuals experienced on the back of the services that are put in place. You'll see it 4.4.1 of the main report. We can see the evaluation, and just to kind of re-emphasise, it's moving feet to kind of receive even a good, never mind a very good. So we've kind of gone through that process, received 4 goods and a very good in terms of our strategic planning, policy, quality and improvement. And as I said, that was kind of on the back of engagement by the inspectors of quite a considerable number of people in terms of service users, but also kind of wider stakeholders, including our kind of voluntary third sector as well. So it kind of gives a good overall view of an integrated system that's kind of working well together for people with a mental illness within Dundee. So we'll take all the kind of positives and really kind of key strengths in this 4.4.2 in the report. We'll kind of go through them. And as we've heard, we've got the kind of good practice examples that will be picked up and shared today as well. As with all of these reports, inspection reports, they've got to find something that we need to kind of improve on. So the 4 key areas of improvement set at 4.4.3, and that's kind of reflected in the appendix 2 in terms of the response to that. And it's probably fair to say in terms of our self-evaluation or self-assessment before the inspection process took place, that certainly there were a couple of areas in there that we already knew about were a bit kind of weak from our perspective. As you would expect, we've got an action plan in place for those, and we'll report back to the IJB in future in terms of progress on that. Obviously, we need to kind of confirm with the inspectors that they are content with the plan and then the progress after that. So hopefully, it's good to have a really kind of positive inspection report and testament to everybody involved across our whole system to make sure that's delivered. So thank you.
Dave, can I just try and say thank you for the opportunity for us to come along and sort of talk about some of the work we do. We could have brought a whole host of people, but we did look for the good practice because we thought that might be what people wanted, a bit more knowledge or detail around. But there is a huge amount of work taking place, and we are exceptionally grateful for the work that people are doing and our workforce are doing in order to support the people across Dundee. So thank you for the opportunity, because we were very happy to be here, and it really is a good news story for the whole of our services and the whole of our network are celebrating this report. So thank you.
It's an excellent report, onwards and upwards, because I think there's still a perception that maybe mental health services aren't that great, but I think what we're doing pretty well in terms of providing services and the requisite outcomes. I just hope that we'll see an improvement in the statistics which continually damage the people number who have taken their own lives. The 23%, I think, of our population are antidepressants. I just hope we see these figures improving, because it does seem that this independent body, which has inspected the services that we provide along with our partners, DVVA, Veterans First Point, etc., we're doing a good job. I just want to see an improvement in the stats, which are reflective of the outcomes, of course. So thanks to everyone, and I don't see any further hands. I just want to say thanks to everyone, of course, not just the people who have come here and made a presentation today, but to all the staff who provide the services, which have led to what is a really, really good report. Thank you very much, and I'm sure that the other members of the board will echo me in saying that. Bob?
And thanks very much. I just concur, Chair, and I think this is a very positive report. And I think it just demonstrates how much good work is really going on across Dundee. So compliments to everyone who are involved with this. I just wanted to pick up one of the areas of improvement as the Chair of PAC, is that would this report be coming to the Performance and Audit Committee to pick up on one of the improvement areas?
Yeah, thanks for that, Bob. So yeah, we would take this back through the park in the first instance in terms of that kind of monitoring of the kind of the progress of the action plan, and then we would kind of take it back to the IJB once we're kind of completed that. So so back to closing the loop, as was kind of mentioned earlier.
Thank you very much.
Thanks very much. So the report is for voting other than at 2.4, where we ask the Chief Officer to make arrangements for a further update no later than the end of the year. So thanks very much. I'm going to call for a 10-minute break at this point, so we come back at 11:25, please. Thank you. I think that was back, but the reason the 4 seats are empty because that was the presenter, right? So I think everyone is, I hope everyone's back online because it's time to restart the meeting. Ali?
Thank you. That takes us on item 5, Strategic Planning Advisory Group Terms of Reference Annual Review, and this is for a decision.
Yep. Dave, would you like to speak to this, please?
Okay, thank you. So just for members, we've agreed previously that we're going to review on an annual basis our terms of reference for our statutory strategic planning advisory group. So this is in the main text there. This is something that we have to put in place in terms of our obligations under the 2015 Act. So Catherine Sharp kind of heads up our chairs our strategic planning group, and under her leadership the group is undertaking a review of its terms of reference. In terms of there's been some minor changes, but probably the one taken in pick up the biggest significance, is around that kind of expansion of the list of other persons to be appointed to the SPAG, including additional lived experience representation. Excuse me. So while there are a kind of range of kind of legal requirements in terms of who needs to be involved in a strategic planning group, we also have that kind of flexibility to kind of add others as we feel fit. And therefore that's the kind of main change for this side of the lived experience representative members. That's the kind of main change. So looking for endorsement from the IJB for that updated terms of reference.
Anyone have any comments? Yeah, Martin.
Thanks. I had a meeting with Dave on Monday, and I raised it with him, so I'm going to raise it with generally the board. I currently sit on the ISPAG, and have done since I've actually even before I sat on this board. The question I have is relating to the changes that are going to be taking place to the role that I currently occupy, being the care representative in terms after September, gaining the voting rights. Now there's going to be additional responsibility to that. So my question is, does my attendance of the Strategic Planning Advisory Group remain the case, or should I be withdrawn from that group? And that's a question I raised with Dave, but he asked me to bring that to the meeting itself.
Yeah.
So again, thanks, Martin, for raising that one. And as general, we don't have the sort of guidance around the changes around the voting for IJB members and what the responsibilities will kind of lead to around that. I think it's something we do need to kind of take away, and once we better understand that, to make sure there's not an impact on that kind of role, because the strategic plan, it says in the tenants, it's an advisory group, so it's an advisory group to the IJB. Well, so one lens you could say, well, actually you are advising yourself back into the IJB. However, there's also the fact that there's other members within that group that will play a similar role, so we need to make sure we've got clarity in terms of each of the rules within that. So that may mean a kind of slight revision in terms of back to the terms of reference, but I think once we're kind of clear on that, we can review it.
Okay, thank you.
Joyce, you want to come in, please?
Yeah, when the SPAG was set up, there was a discussion in SPAG about preferring it not to have the board members at the SPAG, that it felt it was part of our processes to test ideas and to discuss things, including things like impact assessment, etc., that allowed us maybe a bit more freedom of discussion than you would have in an open IJB meeting, which is recorded in public. And so it was a kind of, it felt it was to allow us to look at all angles of our business before coming to a conclusion that would then be passed to IJB. So I think there are a lot of things to explore, but there's also the SPAG itself needs to endorse the final decision on it.
And it didn't make any difference to what we're agreeing today, though. Nicola, yeah.
Thank you. I'll just build on what Martin, Joyce and Dave were saying, because I did have a query with regards to the wording on the report, section 4. Individual members will represent stakeholder groups, structures and organisations, professionals or localities, etc. So I think with this meeting it would be useful to clarify the service user representative on the IJB, what their actual role is. And what that means to them specifically, and then also in due course we will need to take into account the voting rights and what implications that has as well. So yes, to be continued, it seems.
Sure. The thing is, Martin is no less a board member at this time, though, than he will be when he has voting rights. He'll be a board member then, just as he is now, except he'll have a vote. So what's going to be so different?
But I mean, I think there is that aspect around, there's that slightly different dynamic that actually there will be an influence on the vote, and therefore the advice that's provided from the SPAG up to that.
I would always hope that we take into account, even without the voting rights being in place at the moment, the views of every single member. We certainly did that all the way through the budget process.
Yeah.
And I know that Martin himself made quite a contribution in the budget process. So he's no less a board member than I.
No, not at all. That's certainly not the intention. Yeah. That's going to reflect it. So.
And that approach in Dundee is perhaps not reflected across Scotland. So we will. That's great in Dundee, and that's definitely the feeling that I get from it as well. However, with the additional responsibilities that might come out from Scottish Government as guidance, I sit here as a service user representative representing my views. I do not sit here at the current time representing any particular group. Whether that's right or, I won't say the word wrong, but I certainly agree with the development, and there has been conversations about that I've been involved in, and as Martin has as well. So yes.
So, yeah.
Just for brevity, would I suggest that we take this offline and
absolutely.
Have it an action, for the action tracker?
Yeah, absolutely. So Dorothy, followed by Joyce, please, and then that's all.
Thanks, Ken. Under the terms of reference appendix number 3, membership, I see that we have a children and families representative. Have we at any stage considered including an older people's services representative? Although I'm not sure if there's a pathway to including such a representative, certainly not through Dundee City Council, which doesn't have a specific department, might be easier through NHS Tayside. but have we considered adding an older people's services representative, and should we consider adding such a rep?
Can I maybe answer?
Okay, Joyce.
Oh, yeah, Joyce.
In terms of children and families being a separate service to health and social care, I think that would be why they were asked as representative. But it's usually got Angie Smith, who manages older people's services. So if we're talking about the services representative, then I think it's probably quite well covered by many of the people there, but not specifically about older people. The other thing would be that the representative from Children and Family Service, it's not a parent or a child, it's not a service user representative, it's colleagues within a service. So I don't think it's necessarily been considered, but it could be looked at. What you then would have to look at is, do we have a specific learning disability representative, physical disability representative, sensory impaired representative among all these groups? And the other thing to see was that other board members, the board members with voting rights and responsibilities, are not invited to the SPAG. So if we continue to have the service user representative and the carer representative, do we need to consider opening up the invitation to other board members who are presently not invited?
I'll have to reflect on that, Joyce.
Yeah, so thanks both for your comments there. I think in terms of the kind of your point there, Dorothy, about older persons, I mean, so the kind of legislation itself already kind of gives that opportunity. So the users of social care is quite broad. So you know, it can be kind of more than the kind of the representative got just now. So it doesn't stop us from doing that. I think in terms of how the strategic planning group works most effectively is having the voices from all the kind of various other kind of strategic planning groups that sit underneath that. So Joyce mentioned things like mental health, learning disability, etc., and how they interface with the strategic planning group. I suppose it'll be a judgment in terms of whether the voices within those particular groups are heard and are being kind of reflected back up into the strategic planning group. But it's something, Dorothy, what I'll do is I'll take it away with Catherine and have a discussion with Catherine around it, and see what might be kind of feasible around that. As Joyce says, maybe we can open it up even wider than just the older people, and it's kind of a wider group. If that's not, I mean, that's what we've been looking at anyway through this, is how we can expand that membership anyway. So let's just make sure that it's kind of manageable within workload that's required. So we can take that as an action.
Thank you, Dave. Can I just say, I mean, I raise this in light of the strategic frailty group that used to meet and is no longer in operation. So it concerns me. That was a sort of a forum for older people, and that no longer exists. And I just think there's a gap here that we need to look at.
Thanks, Dorothy. Yeah, the plan is still to reinstate the frailty strategic planning group rather than an older people's group. But the plan is to reinstate that. I have had early conversations with Christina Cooper, who was the chair. But at this point, we're trying to clarify who needs to be a part of that to make sure it's meaningful and not just the services telling other people what we're already doing as it kind of morphed into previously. So I'd be happy to pick up a conversation with yourself about thoughts as to how we do that.
Thanks, Angie.
Okay, thanks for raising that, Dorothy, and conversation with great places. The result of you raising it in the meantime, I'll be happy to approve the recommendations and from 2.1 to 2.2, in particular to approve the revised terms of reference and to remit the Chief Officer to review the strategic risk register. I see no dissent. Thank you.
Okay, so that takes us now on to item 6, statutory children's rights report, and it's for a decision.
I think you speak to this.
Yeah, no, thanks, Chair. So I'll kind of introduce this and see Joyce and Claire are on the call, so we can have some kind of detailed questions. So, so we have kind of one of the kind of listed public authorities as an IJB to under the United Nations Convention on the Rights of the Child to publish a children's rights report. Now, given that we don't actually have children's services directly within our IJB's kind of role, that is still important. It's kind of relatively limited in terms of the kind of range of kind of overview of services that we provide. So what we've done, or what we've agreed, or we hope to agree, is that we would incorporate the Dundee kind of children's rights section within an overarching NHS side report. So as they make their own kind of legislative requirements, we would be incorporated within that particular document. So we set out at Appendix 1 to the report, just what that kind of would look like from a Dundee perspective. So kind of covers the areas where we've had kind of overarching kind of responsibility to ensure that kind of children's rights are respected and taken into account when planning for these particular services. Again, I think it's probably fair to say in terms of the recent budget considerations, again, as part of our impact assessment, that we have also considered that kind of wider impact on any decisions made on kind of children and families as well around that. And so the report looks to kind of get approval for the input into that overarching report. And I suppose the other consideration for us will be in potential future IJB's kind of responsibilities for children's services planning and where that kind of may take us in the future as well. So maybe that in future years this is a different kind of arrangement, but as of now we're recommending this kind of course of action. But happy to take any questions on that.
Are there any questions from members? Colin.
Just a quick comment, really understand this bit's just a kind of tick box exercise that it's a legal requirement, but just a thought that, and I see it is noted in from 2026 to 2029 what the IJB is going to focus on. I think there is a lot of space still there for having the children's voice come through in some of the decisions that we make. It's mentioned in the budget consultation process that would maybe be a plan, which I think would be excellent if there was a way of doing that. I know that this can be really tricky because it's something that the patient experience team in NH&SCP side are incorporating something like that just now. So if there's any learning to come, they might be able to share some learning as to how they're managing to get feedback from children. That's kind of a journey they're on just now. But yeah, welcome any additional input from children and young people.
Thank you, Colin. So are we happy to approve the recommendations to note the status of the IJB as a listed public authority, etc., to approve the proposal to discharge the statutory duty, to produce a report at 2.2, to approve the content of the children's rights report at 2.3, and finally at 2.4 to remit the Chief Officer to review the strategic risk register. Are we happy to do so? Yes, thank you.
So that takes us now on to item 7, Audit Scotland Annual Audit Plan 25-26, and this is for a decision.
Thank you. I'll pass over to Rachel just in a second. So Rachel's here from Audit Scotland as our Audit Director. So this is the plan for the annual audit report for 25-26. It's just a couple of points just from the covering paper. So the proposed audit fees noted in 3.1, and this is in line with fees from previous years. The audit plan itself highlights one key financial risk and one wider scope risk, but these are summarised in 4.2 of the covering report, and obviously more details through the appendix. The IJB members are asked to specifically note to note the governance section relating to communication of fraud and suspected fraud. This is highlighted in 4.3. And in 4.5, I've highlighted the anticipated audit timescale for this year, with an intention to present unaudited accounts to the IJB in June before handing over to all the PAC Audit Scotland, and the expectation that the audited accounts and the audit report will be presented to the IJB in October, so that's slightly earlier than previous years. We took November to PAC for the last year, and with a target to return back to having this completed by the end of September in due course as well. But I'll pass over to Rachel, who will pick up all the key points and all the essential points from the main audit plan that the members need to be aware of.
Thank you, and it's lovely to be here today. I'm Rachel Brown, I'm an Audit Director at Audit Scotland, and I'm currently your appointed external auditor. I will say today there is an intention that we change the appointed auditor for the IJB because some new audits have come into Audit Scotland, and I will be taking on those new audits. So something has to come out of my audit portfolio. So my colleague Pauline Gillan, who is also an audit director with extensive experience of local government audit and IJB audit, which is currently the Angus IJB external auditor, she will be coming in during this audit year as your incoming external auditor. So after I've presented the plan, I'll have handover meetings internally and arrange introductory meetings between Pauline Gillan. But the staff doing the audit work will remain in my team. That should be consistent, and I'm hopeful that the IJB won't feel any difference in the audit that they're getting from Audit Scotland. So an important point to note in the plan, there are certain elements that auditing standards require me to draw to your attention. So the first one being that I and my team are fully independent of the IJB, coming in as your external auditor, and that we are compliant with the required ethical standards for our profession, and that's set out in paragraphs 2 and 3. Paragraph 5 summarises the scope of the audit, which is not just the audit of your annual accounts. We are also, in the public sector in Scotland, required to cover wider scope areas of financial management and financial sustainability, and I'll talk about that risk shortly, vision, leadership and governance, and your use of resources to improve outcomes, which are elements that come from best value characteristics. And my assessment, or indeed Pauline's assessment of those 4 areas, will inform our conclusion on your delivery of best value. For accounting and audit purposes, you're considered a local government organisation, so there's a statutory duty of best value that the IJB needs to deliver, and I'll cover that a bit later in the plan. So the paragraph 5 summarises the key elements and the opinions that will be signed on the various elements of your annual accounts, and the conclusions that you'll get in the annual audit report at the conclusion of the audit. The plan sets out the respective responsibilities of the external auditor and the IJB, and as your Chief Finance Officer has said, at paragraph 9, if there are any matters of fraud or suspected fraud that have not already been communicated to me, now is the time to raise them, or if IJB members have any concerns about how officers keep them informed of counter-fraud activity and any fraud-related matters, also please bring that to my attention, and Pauline will ask for that assurance when bringing the annual audit report at the end of the audit. I should just say we form a fraud risk assessment as part of our planning risk assessment work. We hold planning meetings with officers so that we are cited on what's happening with the IJB and the partners. Audit Scotland also audits the council and NH&SCP Tayside, so we get that overall view of all arrangements related to the IJB. So I will pause in case there's any matters related to fraud, hoping that there will be silence and no hands up.
I certainly don't know.
Thank you. That is good.
I don't see any other hands, so.
Super. I'll just.
Thanks for asking, though.
I will crack on with the section on the audit of the annual accounts, which is the substantive part of our audit work, but not the full extent of it. And just to draw to your attention in Exhibit 1, those materiality levels are the levels at which, if we found a misstatement in your annual accounts, I would consider that to affect my audit opinion if it was not corrected. So that's the magnitude of error that I consider would influence decision making by anyone using your annual accounts for decision making. So just so you're aware of that level of materiality for my consideration of my opinion. Performance materiality is a trigger point. Again, if you found a misstatement in the annual accounts of that magnitude, I would consider doing additional audit work. And the final materiality level is just a reporting threshold so that we don't bring tiny errors to you, so you don't have a long annual audit report of trivial matters. So that reporting threshold is based on my judgment and is 5% of materiality, which is in line with Audit Scotland's audit approach on reporting thresholds. The next point to bring to your attention is the significant risk of material misstatement in the financial statements that we have identified by the planning and risk assessment work. And this is a standard presumed significant risk. In auditing standards, all auditors are required to consider and address that risk. So that's not specific to the IJB. There's nothing non-standard in our planned audit response, but we are required by auditing standards to consider and address the risk. And how we address that for the IJB is that we are reliant on auditor assurances from Dundee City Council and NHS Tayside auditors. I will remain the NHS Tayside auditor, so I have full confidence we will get those assurances from the audit team in time to complete the IJB audit. But we set out in that exhibit how we're going to address the risk, and when we bring the annual audit report to you, we'll set out our conclusions based on that audit response. We also flag that we'll report any key audit matters that we identify in the audit, which is generally areas where there's significant judgment or estimate in your accounts. But there's nothing specific raised by our planning and risk assessment work at this stage. Moving on to the wider scope and best value section, that summarises the 4 wider scope areas, and we do identify one significant risk in terms of wider scope, which hopefully is not news to you, and it's quite similar to last year in terms of financial sustainability. You've obviously had a recent budget meeting, you have financial monitoring report on today's agenda, so that predicted overspend of the IJB, the reducing reserves, the significant financial challenges that you have. I know you're not alone in that challenge, but for this audit we'll be reviewing the actions of the IJB to recover the financial position. I don't come with any easy answers for you, but just to say we'll be reviewing and assessing your response to that significant financial challenge. You'll see similar risks and audit focus in other IJBs, again on that financial sustainability picture. And national reporting by Audit Scotland again highlights the significant challenges that IJBs and partners are facing, and the need for public sector reform to drive a different way of delivering services and a different way to engage with the public about the changes that need to happen, because the current way services are provided is not affordable. So that's the only specific wider scope risk that requires additional audit work from the audit team. The rest will do standard audit work on those wider scope areas and comment on it. I mean, financial management will focus on the outcome at the year end, the quality of your unaudited accounts. In previous years that's been very good, and the level of findings reported in last year's annual audit report reflects that. So there was nothing specific additionally that I was going to say about wider scope and best value. We will form an assessment on your arrangements and report that back to you. And the next section of the audit plan sets out the timetable for that. And at paragraph 28, I note that unfortunately I don't think we will achieve the 30th of September deadline for auditing local government accounts. Aiming for that October date will allow the IJB to publish its audited accounts and the annual audit report by the 31st, I should say, of October, which again is a requirement of local government. and we would intend to sign off by the 30th of September. Chief Finance Officer has referred to incremental improvement on timing of the audit. That dates back to COVID times and pausing the audit process to allow frontline services to be provided. But that incremental improvement, I don't think it's going to be practical to do it for this 4th year of the audit appointment. But I would hope that we deliver that in year 5. And we'll work with officers to deliver that. The audit fee set out in paragraph 30 and was highlighted in the covering paper. That's the baseline audit fee that's set for Integration Joint Board. So that's standard for a well-managed audited body, IJB, where we've not identified significant additional work or additional risks requiring audit focus. So that's, I'm supplied as your appointed auditor with a baseline fee and expect this is not was notified to the Chief Finance Officer annually. And there's a 4.3% sector increase in fees across all local government audits. So that's reflected in the baseline fee there. And the final section of our annual audit plan is just to inform you that we take account of what internal audit do, we engage with internal audit, we are not reducing our audit work to place formal reliance on internal audit, but everything they produce we read and take account of to inform our assessment across those wider scope areas. And I also summarise the audit quality arrangements within Audit Scotland to ensure that the audit services provided are of an appropriate quality. And the last point is that we'll seek feedback from the IJB formally, I think annually, but also informally would welcome feedback from the IJB, either direct to me or Pauline, or to the Audit Quality and Appointments team at any point. So that was a bit of a whistle-stop tour of the annual audit plan. I'm happy to take questions on the plan or the audit process or the change in appointed auditor. Thank you.
Thank you for that. That was interesting. Do anyone have any questions, comments? I think you talked through that very well, other than Dave wants to do that.
No, it's just to finish with assuming we'll be content with the plan. I was just going to pass on my thanks to Rachel and Fiona in particular for kind of their leadership around our audits over the last couple of years. So I think we're fair to say, Christine, found really good collaborative kind of approach and kind of very supportive approach as well in terms of kind of trying to look at some challenging issues. So just like to thank Rachel and the team for that. I look forward to working with Pauline and others when they come in. So thank you.
We're happy to agree the recommendation to note the content and to approve the proposed audit plan. And that's a yes.
Could I make a very persnickety audit point in that technically you don't approve the external audit plan, you should just note it.
Okay.
You can approve internal audits, but, and if there is any comment on the plan.
Yeah, because it's not for us to approve because you've submitted it, yeah.
Essentially because we are a statutory external function. We say this is...
Yeah, you're right, yeah. I see your point. So we can make sure that is reflected in the minutes that a change was made. I wish it's me that spotted it rather than you.
Should have spotted it before today, so audit failure.
So thanks for that. So yeah, it's for noting then, so we're not approving that. But we are approving them, but we don't. Thank you very much.
Okay, so we'll move on to item 8, which is the financial monitoring position as at February 2026, and this is for noting.
Okay, thank you. So this is our last routine financial monitoring of the financial year based on the figures up to February, between 11 months of the year. I will just say that my team are now frantically working away on the year-end position and starting the work on to draft up the annual accounts figures. So that's where we're at just now from the financial perspective. So the figures that are presented now today unfortunately show us a small deterioration from the last set of figures that were presented based on the December position. And we are now projecting an operational overspend of 4.961 million for this financial year, compared to 4.675 at the previous set of reported position. as I'm sure you'll fully understand and appreciate, the key pressure areas underlying demand continues to drive our overspend position, notably around the old people care at home and the demand aspect of that. But we've also had some other changes in the last little while that were unanticipated earlier in the year as well. So we've also got some additional spend that's come through relating to adult mental health and learning disability placement costs, including some higher than anticipated complex care packages and some impact of backdated uplift fees as well. So these are noted in section 4.3.3 and 4.3.4. As we highlighted back at the start around the action tracker, the absence levels and supplementary staffing costs are also continuing to be a cause for concern. These are higher than what I've written down here is desired, but obviously we're looking to try to manage that cost pressure and that position as much as possible. So then these are noted in section 4.3.13 and also the graphs in appendix 6. And despite ongoing efforts right across our whole system, all our managers, and been a financial recovery action to continue to look at this and address it. I will just say though that the spike or the recent change in trend in the Dundee City Council supplementary staffing spending over the last couple of months is actually distorted by one particular crisis situation that I've highlighted in the report as well. So that is something that is continuing to be looked at and supported and trying to get addressed. But at the moment it is causing us a particular spike in sort of premium costs while we're trying to look at that particular situation. One other area that has unfortunately deteriorated since the last report is the cost pressure related to the Tayside GP out of hours position. And that's resulted in an increased cost pressure through the lead partner risk share arrangements for Dundee. We continue to be working with our colleagues in Angus and wider Tayside to support the process to address the overspend. And it is hoped that a report will come to all three IJBs and NHS Tayside over the next couple of months with that report coming to the June IJB if it can be completed in time. So there's been a fair bit of work going on in the background to understand and look at the service as a whole. There has been a sort of changes in demand and activity from post-COVID, so they're trying to understand exactly how the service should be structured and managed going forward has taken a bit of time to look at that one. And recognising that obviously we have been in financial recovery through much of 25-26 and significant efforts have been made across a number of areas in terms of good progress. It's disappointing that we've got some of these unanticipated costs at this stage of the year, and some of that being spend that's actually out with the direct control of the Health and Social Care Partnership management team as well. So these have contributed to our projected position that we're now reporting. Based on this latest information in Appendix 5, I've noted the sort of projected closing residual balance of about £3.4 million at this stage after we've used some additional reserves and still expecting some shifts in terms of the last final month. I will just note that these figures have been highlighted with our finance colleagues in NHS Tayside and Dundee City Council as soon as the information was noted towards the end of March, early April, and just to ensure that they've got an appropriate provision built into their own positions under the integration scheme risk share. So they have been very much aware of the position as well. So at this stage, the IJB are asked us to note the latest financial position, and happy to pick up any questions that any members may have.
Anyone? Yeah, Nicola.
Thank you very much for that, for going through everything. It's really complex. I'm going to focus in on section 4.3 on 12, and it's in regards to under recovery of income for chargeable social care services. And as a parent, guardian, carer who facilitates payments for chargeable social care services for a service user, I have concern under recovery for social care services, as I'm sure you do as well. So a couple of comments here, because it's not all bad news. I know that there's certainly been some improvement recently in receiving invoices timely, so that's really fantastic. I also note timely responses from social work finance when queries are raised, so that's really useful to us. However, feedback from myself and a number of other people, so I'm not just speaking for myself on this one, is that the charging policy and the invoices, they're not always clear and easy to interpret. And often we're just kind of nodding our head that we understand it when sometimes we don't really. And yeah, rather than just email and social work finance, who do give responses back, yeah, some other route to actually understanding it from the beginning and right the way through might be useful. The query is, what percentage of funding and/or invoices and/or service users does this relate to? I'm not actually expecting you to come away with that at the moment, but I'm wondering whether that's something, is it appropriate to bring it up in the Performance and Audit Committee? Because I think just saying that there's under recovery, you know, what does that actually mean? What's the percentage of funding?
Okay, thank you. I don't have that information to hand to share that one with just now, but we have absolutely recognised that the income levels have dropped quite significantly over the last few years, and we think it's probably a combination of a number of aspects. And we do have a project team that's been looking at the totality of this. So there's there's an element of people are only charged for their eligible income. So as the cost of living increase has kicked in, then actually the available eligible income will have dropped, and therefore the charge and recovery has been impacted across a number of it. But yes, there is something around our communication with service users and getting billing out timely and clear and communicating in advance. So I think that I'm glad to hear that you feel some of the communication has improved. So the project team has been working on quite a number of different aspects around recovery of chargeable services, and both making sure the bills go out, setting up people offering to go into direct debits, and picking up any unpaid bills at a quicker stage, so that the debt isn't allowed to accumulate to a level that becomes then unmanageable. So thinking of all of this type of thing, and that project team is continuing to work across the entirety of the council part of the system, because it's not just our health and social care partnerships and the communication with the social workers or care managers. It also becomes our work with providers to get the activity into the system to actually get the charging out. It also comes in getting the billing out on a timely basis, and that communication to explain the billing, and also then the debt recovery actions, which and our Welfare Rights Council team as well, who are looking at eligible income and financial assessments for individuals. So it is a much broader piece of work that we have a quite substantial team. It's showing some signs of improvement, but I know that there's still more work to do, and that under recovery is coming from a combination of all these perhaps different reasons. Some of it people not paying, people not being charged, but also then the eligible income as well. So it's not an easy thing that, as it's been developing. It's kind of, we've recognised more and more parts of the system that we can make enhancements and improvements to. But we are continuing to be driving this as best as we can, and I'm absolutely recognising that if we are not recovering income through chargeable services, then that means that we have less funding to support other people as well. So we do recognise that if it's chargeable service, we should be trying our best to be recovering that charge as well.
Okay, thank you. And just note to your team that is filtering down to service users as well, that some things are improving. I'll go back to the park question because I see Councillor Benson there, who chairs the park. I would just like to also note the letter, the covering letter that comes out at the beginning of the year. That's actually really useful and clear. So again, thank you for that. And is that something that would be brought up in the Performance and Audit Committee or another forum with regards to progress on the recovery of the charitable services income?
I'll look to see how we can actually incorporate it into the finance report rather than trying to take it separately when it comes to the IJB, and work with the project team to see if we can even get some kind of interim detail about what has been able to be progressed and developed, and the next stage is what we're working on as well.
Okay, thanks everyone.
Okay, David Cheek, please.
Yeah, thanks, Ken, again, and for the paper. Just expand a little bit here, Christine. It concerns me a little bit. Clearly, you've mentioned the main reasons or the main area where we've exceeded our last projection for the year end, but it's undoubtedly it's the mental health services that are there. And I'm a bit concerned that in December we had a figure of an £800,000 overspend. And now 2 months later, it's 70% more than that. It's 1.4 million almost. Is there anything more specific that we can actually determine what's caused such a major increase in a couple of months?
I probably need to go back and look at the detail in behind some of this. It's a combination of a few parts of it around some backdated costs that we were not expecting to be, or we were not aware of and hadn't built into some of the plan, and particularly some complex positions as well around some care package costs. But I'll have to go back and have a look at the individual detail around some of it to come back to you.
Okay, thank you.
Dorothy, please.
Thank you. Thanks, Christine. 4.3.13 talks about supplementary staffing spend, and 4.3.14 gives us information on absence rates. And I know we've already discussed plans to explore absence rates further, but I would like to ask, and I've probably asked this before, for Dundee City Council employees, the rate is given as working days lost. For the NHS, it's an absence rate. Now, these are not directly comparable. Is that correct?
They're not, and it's figures that are produced by the two organisations, and in terms of their reporting methodology. It's also worthwhile noting that some of the reasons for absence as well will be captured differently and therefore incorporated slightly differently into some of it. So in terms of allowable absence and time off compared to but in one organisation might be slightly different to another organisation in terms of, I don't know, bereavement or carers leave or something like that. There will be slight differences in terms of what staff are entitled to and therefore how some of it's captured, so that there will be differences in both the presentation of the figure, but also some of the underlying figures that are captured in it as well.
Okay, thank you.
Colleen.
Hi, yeah, thank you. I'd support what David was saying around that kind of big 70% increase. I would like to understand that a little bit more, just in case it's something that might trip us up again in this next financial year, if it's something that might repeat itself. So I would appreciate a little bit more understanding around that. Can I take this opportunity? I've just been thinking since we started, we were going through the action trackers at the beginning, if you just let me find which one it is, just a suggestion, and my colleagues can also please give me their opinion on it. So number 10, where it is around the consultation timing. Could I suggest that it might be helpful if we have a date put in there that we would think would be appropriate at this stage, because I don't think it can ever come too early, say if it's January, beginning of February, so that we've got something to work to, and just to give assurance that we're not kind of running at the end of the year again like we were this year, so that we have a target, and if there's a reason that we're not going to meet it, then we'll be informed of that reason, and just to set ourselves up a little bit better for this year.
Yeah, absolutely. I think I was picking up through the budget process, and apologies, just the time of the turnaround from the last meeting. We've not gone back in and put some comments into that, but absolutely recognising that the consultation process and in fact the whole timetable for the budget setting for next year needs to be considered. We need to make sure that we're not clashing with Dundee City Council's consultation, but we have it in a timescale that is much more meaningful and manageable, so that we're in a position to make some of those actions and decisions at an earlier stage. Our own internal process has already started for 27-28. We've got an internal timetable that we've drawn up, and we have some senior and extended management teams time planned over the next couple of months to start the process, and both in terms of delivering the current year plans and getting some of that progress early, but actually then the planning for 27-28 and future planning as well, so that we're not just thinking about what we're delivering and what we're looking at for 1 year to the next, but actually having things in the pipeline that have got time, that lead in time in terms of delivery as well, and that whole system part of it.
Steve.
Sorry. No, that's it, Colin. So I think it's a really important point that we have kind of an estimated time scale for us to kind of carry out that consultation. I think the caveat around that would be around the timing of national announcements around the budget. So as you remember, for the current year's for the current year's budget, the Scottish Government budget announcement was a month later than it would normally be. So there's something around the timing of that kind of having to coincide with what we know around the budget, because we could end up consulting on things that we actually need to, because depending on what the kind of the budget looks like. So I think the key thing from your ask is that we communicate as early as possible if there's a change in that. And so as soon as if we say it was like we're going to go in December and January, and then we find out actually the budget's not going to be announced until January, then we'd let you know that will be a kind of a shift in that. So.
Yeah, absolutely. Yeah, that's exactly what I meant, Dave. Just that I understand that circumstances can change and it would have to shift around. But even if we've got something in there, and then we'll just, if it needs to change for whatever reason, then we know, and that's it. Yeah, thank you.
No further on the items for noting, so thanks, and we can move on to the penultimate. No, not quite. Well, the next item.
Item 9 is the meeting attendances, which is submitted for information. Item 10 is a note of the IJB development sessions that have been arranged. And item 11 is the date of the next meeting, which is Wednesday, the 24th of June.
The only thing I would ask is, it's not a mistake, we're having a meeting, first meeting the 20th of October and the second budget a week later.
Just check that one. I think they're probably too close.
Yeah, I think we're too close too, yeah.
Okay, that's a good point.
Yeah.
Fair enough.
There will be something. I think that those sessions are in the diary, but they would both be budget development.
Okay, fair enough.
Something else.
Okay, well, I think that's us then. Thanks everyone for your attendance today, and see you on the 6th of May, if not before. Thank you.
Thank you. Bye.